Hello, everybody. Kelly McDevitt here, President of Integrated Benefits Institute. I hope you're all doing well today. Today we have a great discussion on closing the gap on preventive screenings. I have with me on my team Erin Peterson, who's the lead researcher on this project, and I have Kathleen Herath, who will be speaking on behalf of employers. When we started this research project, this was pre-COVID, pre-pandemic. And so Erin conducted this research beginning with the lens of the fact that in our industry, we oftentimes have problems getting our employees to get their preventive screenings at the recommended frequencies. And so now, as you can imagine, here we are mid-pandemic, that this subject has become one of the utmost importance. And so we hope that you will get a lot of good information from us today. The details of this research project will be published on the IBI website for members. Then after a short embargoed period, it will be published publicly. So without further ado, let me just say a few words about IBI for those who might not be familiar. IBI is a national research company. We are dedicated to the education and linking of workforce health and productivity and business performance. We are a nonprofit made up of about 1,200 corporate members, which covers about 20 million employees. We are a membership company. And so to join IBI, you can find that information on our website. But for the most part, where we dedicate a lot of our time is in research, data and analytics, tools, and then learning opportunities like these. Next slide. So today, as I mentioned, we'll have Erin Peterson, who works here at IBI. She's the lead researcher for this project. And then we're so happy to have Kathleen Herath, who's recently retired, nationwide AVP. She was the AVP of Wellbeing and Safety and is currently with the consulting group of the Pillars Group. So without further ado, I'm going to let Erin introduce the research and go over her findings, and then Kathleen and I and Erin will have a discussion about those findings and what employers really should be listening for, looking for, and then actually executing as a result of these findings. So Erin, I'll turn it over to you.
Thanks, Kelly. So with that, let me further introduce you to our study. So what we wanted to do was look at the interplay between productivity and preventive screenings in the workforce. So in order to answer this question, we wanted to identify first which diseases or conditions have scientifically backed recommendations for screening, how many people in the workforce have each of these conditions, the percentage of people who are screened for each condition, the burden on employers for each of these conditions. And for this, we used IBI's benchmarking data to look at the rate of claims for each of these conditions, the cost in terms of disability wage replacement, and the duration of leave. And we'll go into the findings shortly. So after that, we'll talk to Kathleen Herath about her experience around this topic from her work at Nationwide. And we started this research before the pandemic hit, but realized that there would be repercussions in delayed care, including preventive screenings, as people were encouraged to stay home and see doctors only for emergency services. So we'll wrap up our discussion today with the effect of the pandemic on preventive care and ways to think about managing that impact. And to set the stage, when we identified conditions with recommendation for preventive screening, they really fell into two categories: chronic diseases and cancers. So the chronic conditions included in our study were depression, diabetes, high blood pressure or hypertension, and obesity. And we looked at 3 cancers: breast, cervical, and colorectal. So as we move forward, we'll present chronic conditions and cancers separately. Now, before getting too far into the weeds, let's take a look at our major findings. First, chronic disease is pretty common in the workforce. When only considering the 4 chronic conditions we investigated, about 1/3 of the workforce has at least one. Second, if we consider the impact of disease severity, costs are higher for more severe cases. And this makes sense intuitively, but when we consider that screening can identify chronic conditions early, logically, this should help people obtain treatment before their disease becomes severe. So this has implications for opportunities and cost savings. Now, when we look at cancer, we used age as a proxy for severity and found that when treatment is undergone at younger ages, people take less time off work. And then when we bring the percent of people screened for each condition into the mix, we're finding a wide range in the percent of people screened depending on the condition. But the gap in screening for depression is the largest by far of the conditions we looked at. So in our report, we break down each outcome by condition. But what we wanted to do here was to kind of put everything together for one condition. And we chose to do a deeper dive here on depression for a couple of reasons. Among the 4 chronic conditions we looked at, depression is screened at the lowest rate and has the highest cost. That said, let's walk through our findings here. The first thing you'll notice is that depression is fairly impactful in the general working population. That is, out of every 8 people in the labor force, 1 will have depression. Compounding this, only 9% are screened, so 91% aren't. This is our screenings gap. This means that in a hypothetical workforce of 1,000, about 73 people will have depression who haven't screened for it. And the big deal here is that even though we miss a lot of cases in the general population, they're still showing up in the disability system and in high numbers. In fact, in the entire disability system, which includes pregnancy, injuries, and musculoskeletal disorders, depression represents 3% of all claims. That is 2 times higher than the claims for diabetes, hypertension, and obesity combined. And 1 in 5 of each claim for depression is for a severe case. So when we model it out, not only do we see the largest screening gap for depression, but on a per employee basis, we also see a cost that is over 8 times higher than the next highest cost condition. And this all goes to suggest that if we make inroads in screening, this could dramatically improve productivity and decrease disability cost players, as well as improve quality of life for employees. So when we look at what's happening with cancers, we see that we're doing a much better job with screening than we did for chronic diseases. And we'll focus our story here on colorectal cancer. Like depression, colorectal cancer is kind of the worst performer of the cancers. And what I mean by this is that between colorectal, cervical, and breast cancer, colorectal cancer has the largest screening gap and worst productivity outcomes. Again, we're doing better than depression, but 1/3 of those eligible for screening still aren't getting them. And at age 50 to 54, or the age at which screening is recommended for colorectal cancer, those diagnosed are less likely to take leave than those diagnosed with cervical or breast cancer. And we're calling this the leave gap. But even though they're less likely to take leave when diagnosed, if they do undergo treatment, they're out of work longer than those with cervical or breast cancer. And in addition to this, across all cancers, treatment takes longer at older ages, with the implication that it's harder to come back to work when you're older. So not only are durations longer for colorectal cancer, costs are also higher for those taking leave for colorectal cancer when compared to cervical and breast cancer. So now that I've talked about the problems faced in the workforce that have the potential to be improved by increased uptake in preventive screenings, I'll turn the floor over to Kelly and Kathleen, who will talk to you about practical strategies.
Right, so trying to ground us in, where this study started and the complexity that the pandemic has obviously added to this situation with avoided care, canceled care, delayed care. It's kind of mind-boggling when you think about where we might end up and what these results might look like 18 to 24 months from now. So let me take you back to the beginning before the pandemic when we started this research and why I asked Kathleen Herath to talk about it. So Kathleen and I worked together in former roles, and one of the things that was always stood out was Nationwide's ability to get people to be compliant around preventive care. In fact, in the years that I worked with Nationwide, they were consistently higher than the benchmarking in the book of business on all of their preventive care measures. And so that's why I asked Kathleen to come and talk to you all today, because they've sort of cracked that nut on how to raise compliance and get their people really engaged and get those numbers much higher than the book of business. And so the first thing I want to ask Kathleen is, to kind of give us the overview of the steps that Nationwide took in really engaging their employee population and their families, especially before pandemic, and getting involved in their preventive care screenings.
Thanks, Kelly. So I would say that to use the word relentless would be kind of how we went after the screenings. And I say relentless in terms of being in front of people and talking to people and making sure that that they were constantly seeing it. And I want to break it out in just a couple of examples. And I'm actually going to start with the colorectal cancer. It's really interesting to me that it has among the worst screening and has the largest gap. And in fact, it's the one screening that actually prevents cancer, right? So early screening for mammogram and pap smears, they find it early. They don't actually prevent it. One of the things we know about the colonoscopy is actually they can remove those and they can actually prevent cancer from happening. And so we spent a great deal of time through the early 2010, 11, 12, really educating our associates about the importance and building on it literally year after year after year. About the importance of not missing that one. And in fact, we sent a birthday card to everyone under the age of 50 that was from their older self. And the two things we were really pushing was making sure that you had that colonoscopy and your financial wellness, right? Because what would your 55-year-old self tell your 35-year-old self? And it was very tongue-in-cheek, and the font was tiny. And we said, if you think this font's tiny now, wait till you're 55. So we did a little bit of humor with it. We used to talk about happy birthday to you. When you turn 50, get a free colonoscopy. And really kind of trying to demystify it, but just constantly bringing it up in every benefits presentation about optimizing your benefits. And I used to actually say, like, if you're 50 or over, happy birthday to you. If you're under 50, you need to tell your parents. Like, this is something that people commonly need to talk about, know about. It's just not something that anyone should be missing. If any of you are sitting out there, 50 and over who have not had that done, it's really not that difficult. This is a screening gap that you can close using education, using humor, using a combination of both. It's kind of an uncomfortable thing that nobody really wants to talk about, and you got to step in as an employer and do that, because you can make a huge change. And the downstream implication of that is the earlier that you find it, obviously, the better the outcomes. And that's going to be cost savings to the plan. From a health plan perspective, it's going to be cost savings from your disability, because you heard Erin talk about the fact that it's the longer disability. But the quality of life savings to that person is just amazing. And then once you get a couple of folks who maybe step into it and do it, create a testimonial campaign, have them talk about it. It's one of those things that it's a silly barrier that for people to be uncomfortable about. We definitely need to do that. And I think there's some really creative ways. And I will tell you, I'm terrified about what's going to happen in the next 18 months in terms of the missed preventive care from 2020. So I think employers really need to make sure this is, you know, a critical education point. And I know that everybody's been trying to communicate so much around COVID and understanding what's happening there. Don't forget the importance of your just regular messaging. And I think that associates and employees are really open to hearing the messaging. You've probably been doing a lot more broadcasting and a lot more meetings, a lot more electronic. Don't forget to step in and do all of these other things. Here's your checklist for the year. Did you have these things done in 2020? And if not, it's time right now to start scheduling and try to get in first quarter of 2021 so that we can kind of prevent that. Kelly, you want me to keep going on the depression?
Yes, please. I want you to hit depression, and then I want to layer in, as you're thinking through that, you know, we've studied in this industry, seems like ad nauseum, to incentivize or not to incentivize. That is the question. And is it a waste of money? Is it a great investment? And I know for Nationwide, it has been a fantastic investment. In fact, Nationwide has had one of the highest compliance rates and earners of incentives that I've ever seen in a book of business. And so as you're talking about depression, maybe also talk about the role of the incentive.
Sure. So in terms of the depression, I think this is another one that not only is it necessary, I think probably more than ever before in our working careers, people are actually open to the idea of admitting that they need help from a mental health perspective. You know, one thing COVID has done is give people permission to kind of talk about things that maybe we didn't talk about in the past. We were already facing quite an issue, as you saw in Erin's data, before COVID happened. So, you know, if your folks are telling you they're fine and they don't need mental health services, I'm going to say not true. It's just not possible given what everybody has been under this year. So one thing I will say is that prior to the pandemic, we talked a lot about within the depression space about asking for help and getting mental health for the mentally healthy. We have a tendency in the United States to talk about mental health for the mentally in crisis or the mentally ill with a diagnosis. And we don't talk about what does mental health mean for folks who don't have a mental illness and are not in crisis, but don't necessarily understand, you know, on a scale of 1 to 10, here's your brain anxious 1, 2, and 3 is where you want to live in terms of dealing with your anxiety. When you get to 4, 5, or 6, here's what it feels like, and here's what you do to get yourself back to 1, 2, or 3. Get to 7, 8, or 9, you probably might need some resources to get yourself back to 4, 5, and 6 so that you can get yourself to 1, 2, or 3. Everything in the United States tends to be built at that, you know, now you're in crisis and you're at 10. And so, one of the things that I would say that, and I think that we found over the last 2 years, we've really had a focus on it at Nationwide, was to stop normalizing misery. And we have a tendency, many people who are of a certain working age grew up at a time that, you know, if you were 16 and you were clinically depressed, or you were 16 and you were pouting because you didn't get a new pair of jeans, your parents approach that in the exact same manner. And so we have this tendency to normalize misery, and we need to stop doing that. We need to get people to start having the conversation and normalize asking for help. And I think one of the positives that could really come out of COVID-19 is the fact that we could normalize this conversation around everyone's mental health and the importance of screening for it and talking about it and putting resources consistently in front of people. You can't do it once a year. It needs to be, you know, all of the time, right? Every presentation, here's the really critical resources. Every time our occupational health nurses were out talking to folks, whoever your folks are, who are kind of boots on the ground, making sure that they can speak to the resources that you have available, and really pushing on your vendors, quite honestly, as well, to what can they bring? You know, we're going to send out this communication about our EAP and how easy it is to use and how many sessions we have, but could they customize that? Can they do something different for everyone who's under the age of 30 versus someone who's, 30 to 45? Could we do something for the over 50 population? Really push on your vendors about creating materials that really speak to who I am and what my story is and where I am in my life, and try to not just spread peanut butter across the mental health services. In terms of the incentives, we have very successfully used the incentives, and we have added actually mental health brain programs as a paid incentive. We had done it for years, got away from it for 5 or 6 years, and then Nationwide actually is going back to that in terms of, in 2020, it's interesting that we put that in place in 19 as an announcement, as an actual program that you can gain incentives. I would say that if you haven't ever tried it, I think there's a lot of positives to it. I think there's some, there definitely is a ceiling you're going to hit with incentives, and then I think it becomes of what's the rest of the why? What's the rest of the why as to people participating in this? And you don't have to pay for everything as an employer. I will tell you that we started very small in one of our locations, Nationwide did, a couple of years ago, doing stroke screenings, and having people, we were giving access, they were giving access only, but having people pay for the actual screening. And it was so popular. We brought it into the Central Ohio location last year, and it actually was no outlay for Nationwide, but it was incredibly popular with associates. And what was interesting, even though it was a stroke screening, they found a number of cancers and as part of that as well. And so word really got out, where can you not only use your incentives, but then talk about your incentives, right? Do you have people who can give voice to, be your testimonials, be your feet on the street, give voice to, hey, here's what I did and I got paid and that was great from an incentive, but here's what happened in terms of the quality of my life. And so together, those two things really can drive more whys for your employees.
Yeah, that's a really good one. I know employers do struggle with where is that teetering point between the outlay for the incentive funding and the return on investment for the incentives, right? But I think coming back to the idea of the preventive care, at the very least, that going forward from this point forward, it has to pay back tenfold to have people getting screenings at the appropriate time. Obviously, from the research that Erin did, we show that catching these diseases and these screenings early is of the utmost importance. One of the things that we were touching on earlier, Kathleen, that I think is frightening to us all is this idea that some employers don't yet have a plan in place because they're obviously distracted by the pandemic around behavioral health and depression. Seeing Erin's research that 95% of people with chronic conditions are not screened for depression is frightening. Now, add on top of that the pandemic, the fact that we're all kind of now part of the sandwich generation, being caregivers, stuck at home, and for those who are out there in the workforce who are actually working, the essential workers, the stress of the entire situation is becoming clear. What do you think that employers can start to think about now, picking your head up from COVID and knowing that those things are going to continue? What could they focus on around this idea of behavioral health and depression support to make sure that while their people are at home, at least those are still at home or out in the workforce as essential workers, how can they get them screened for depression? What could they recommend to get people into the doctor's office or into telehealth so that they can talk with someone to do a check-in, to really check in on their health?
So October is actually depression screening, I think, screening month. I'm just thinking that off the top of my head, actually. So this is a great time. And I would say don't reinvent the wheel. There are great resources that are commercially available, that are available at no charge to say, or reach out. You all have an EAP and say to the EAP, we need something that's simple and easy. And you send it out to everyone and say, like, this has been a year, right? there's so much that we could do under the guise of COVID. There's so much that COVID's causing, right? And so to say, like, you know, everyone has been through this, everyone's resilience has been tested, everyone has been stressed in a way that we haven't been in the past. So we want, as a company, to have everyone do this screening. And then where to go for help, right? So the one thing I will say, and I've said this a lot as I've spoken over the years, please do not put screening tools or information out there if there isn't a, and where do I go afterwards? Whether that's you work with your EAP and you say like, hey, if you answered yes to these 3 questions, we want you to call the EAP, or if you're going to do 9 questions and you scored this score, where do they go for help? So I think it's a really easy, like, hey, let's not let 2020 get away from us without doing something good for each of us, right? So do this with everyone. I think sending out something for your children. I know that when I was with Nationwide, we had a lot of success asking people to do for their children what they would necessarily maybe not do for themselves, right? So, you know, here's a way to check in with your children. Here's a way to check in with your parents. Here's a way to check in with yourself. And here's who to call if you find this. And I think that's a really easy, no cost or extremely low cost way to step in this month or this coming month in October that would make a lot of sense to people. And gosh, when you look at what's happening with our suicide rate and the depression rates that are happening right now, unfortunately, it's not getting the news coverage that some of the fear-based COVID coverage is getting. And unfortunately, I think we're going to see the ramifications of that for years to come.
Yeah, good advice. What do you think about some of the telehealth and app-based solutions that are out there for both checking in for chronic conditions and for behavioral health conditions?
So I think it's a very easy, non-threatening way sometimes for people to step in. I think especially, and it looks like from the reading I've done, the efficacy of telehealth or the behavioral health over the phone has been really good. And it's been attributed to kind of that anonymity of being on the phone and telling the person something that I wouldn't maybe necessarily tell them when I was, you know, in person. So I haven't seen any negatives to that at all. In terms of the chronic disease, I think some of those same kind of concepts probably still apply as well, right? That I know I should be, but I haven't. And so I'll just step in and do this telehealth and see what they say. And maybe that person could be who drives them in if they actually need in-person care. The other reason I think it could be very, very effective for employers is that, and we did see, you know, some of this in my former life at Nationwide. I think it's calming down, hopefully nationwide across the country now, not the company, all of us, but is the worried well. And so we don't want the worried well who are going in for care, who maybe don't need to be going in for care, to kind of clog up the system. And so I do think telehealth is a great way to deal with the worried well and with the chronically ill who maybe are resistant to going in, and having that telehealth doc say, no, you really need to go get seen for this, or having that doc say, hey, I think you're going to be okay.
Yeah, good points all. I'm going to take us back to preventive care overall now. And as you know, an AVP for a very large, very successful company, having these conversations about preventive care, you know, this isn't sexy stuff to talk about your CFO with. And we've been doing preventive care and creating, you know, these guidelines have been out for many, many years. It's just been sort of the holy grail to try and make people go get these screenings. And so how do you, as a benefits leader, speak to your C-suite about why it's important, and more importantly for the CFO, why should you keep investing money in this when the compliance rates don't seem to keep up with what the recommendations are?
So there's a lot in that question. So I will say, first of all, we kind of have to now, right? So when I was at Nationwide, we actually started paying for preventive care years before it was mandated. It just makes good sense, right? If you're catching things early, you're going to save the money. I think Erin actually had some great slides that could be very helpful for people in terms of why we need to spend this money and what it's going to look like. I do think that we sometimes have a tendency to only look at what the health plan cost is for a particular situation. And so one thing I would encourage people to do is say, for those missed opportunities to have caught something earlier, not only taking what Erin provided, but then taking that across your organization in terms of what that means for delayed care, which increases your health plan spend, increases your pharmacy spend. Make sure you're pulling in the pharmacy spend, right? And then make sure you're pulling in the disability spend. I do think that there is a pretty good number of employers that I've talked to who aren't pulling in the disability spend. And then if you take that one step further, what's the impact to the business unit and the lost productivity because that person is out, right? And are you running for your top leaders what their incident rate looks like and their absence rate looks like? So, one of the things that we used to publish in addition to looking at just the health plan spend and the pharmacy spend was, for that senior leader, how many people did they have out on disability on any given day, right? What was that percentage? And then what's the fallout from loss because of that? I think there's an opportunity to take that whole continuum of cost and put it together to tell a story and not just one or two numbers. Because I do think that when folks are, really kind of making those decisions, if you're just making it on health plan spend, you're really short citing what the impact to the business unit is. And that may be what actually triggers action more in that C-suite than just the actual cost from a health plan perspective. Now, go ahead.
I was just going to say, Kathleen, to your point, I think that in years past, typically employers will look at the medical spend as their, number one guiding tool. And in fact, as Erin's research showed, when it comes to disabilities for things like depression, while depression doesn't cost them a lot of money in the health plan, dollars wise, from a productivity perspective, it certainly does cost a lot of money. So to your point, that's very true. They need to look at the full picture.
Yep, absolutely. I think that tells and I think sometimes that's a more important picture for the people who you're marketing that to, right? Like, okay, health plan spend, we expect it to go up by some percent every single year. That's easy to discount. Okay, well then let's take this and see what it means in terms of your staffing, in terms of your sales, in terms of your ability to meet the customer's needs, because people aren't in the workforce and really drive.
Mm-hmm. Sorry, that's right. You're right. So when we saw Erin's research and we looked at things like the effect of interrupted services for serious conditions like we're all worrying about right now, like cancers, and you think about the preventive screenings that could help us, early on in these conditions, can you, when you're thinking about catching a disease early, especially for an older population, if you have an older population within your workforce, what a difference that makes in your screenings at an for older folks at an earlier point in their disease than at a later point in their disease, both from a cost and a productivity perspective.
Yeah, I think, and I think there's a lot that could be done in this last quarter of the year. I think though, don't try to do it all yourself. If you have an internal social networking site like Yammer, if you have a way for people to tell their stories, have them step up and do that. Whether that's a young person who lost a parent because of the lack of screening, or it's somebody who did go and did get care and wants to tell their story. I think that the connection of your employee population can drive more people to go and take action sometimes than just sending benefit communications. And I would say, and I've said this a lot in the past, so I don't think it'll be a surprise to a lot of people, please read your materials and then read them again, and then give them to the people that don't work in the benefit area to read, because there is a tendency within the benefit population to speak what I call benefitese. And it's like, oh, it's super easy. We explained it. It doesn't mean that. And it's like, yeah, that doesn't make any sense to somebody who doesn't actually live in this space. And so making sure that you're open to the feedback of, hey, here's the story we're trying to tell. And what advisory group could you get that in front of? You know, is there a group that could speak to that? Do you have the coverage? You know, that would be the other thing to say is, you know, you tell people to go and do it, and then, you know, you don't actually have the right level of coverage within your plan in the particular locations they live in, right? So making sure you have all of those I's dotted and T's crossed is really important as well. But be open to what your associates and are actually telling you. I know years ago we did a survey. We're getting ready to really change our whole portal, and we asked associates what their favorite benefits were. And at that time they answered things like the gym, free hockey tickets, and medical and dental didn't even come into the benefits. They named a lot of things that were perks that weren't benefits. And, but that's how they talked about it, right? And they talked about their 401k being their money, not necessarily a benefit. And so I would say just be very, very careful that you're getting the voice of the customer when you're trying to explain things, because I do think that, and I've had a little bit of experience with this just recently with talking to some large employers that are doing just that. They have been communicating it, and the only people who are taking advantage of it tend to be the people who are in benefits who understand it, right? Well, that might be the first sign that what you're communicating isn't being done in a manner that either is impacting the person from a why, or they don't really understand it. So it's something I'm always going to get to, but I never do.
Right. Okay, I'm going to ask one last question, and we have a lot of questions coming into Q&A, so I want to give plenty of time so that you can answer those thoroughly as well, Kathleen, and we appreciate your time. So knowing what we see in the research and knowing where we are today, you know, mid-pandemic, where quite frankly, at least for the remainder of this year, I think that people are going to continue to be distracted. HR departments are going to continue to have to do things that they never signed up for. And I feel like, I know you do too, we need to at least dedicate a good chunk of time these days to getting back to basics and really getting back to our core messaging around things like preventive screening. But how to do that and help people feel safe enough to go get their screenings, and what methods could they use to do that? I've spoken to some employers who are considering, even those who are not back in the office yet, opening their on-site clinics, because these are resources where people could come safely and get their screenings done. What other tools do you think employers should start getting back to really getting back on the pathway to health for their employees? What other tools do they have at their disposal that they could do now?
So I love the idea of opening your own locations, because I think it's a safety level that you can control. I think the other thing that you can very easily do, that I know that when I'm talking to people, they're very surprised at, is actually pull out the guidelines for reopening in your particular state for that particular business. So there are guidelines for opening doctor's offices and opening, you know, screening facilities and having those done. And I think if folks knew there's very well thought out, well researched ways to keep them safe, they would feel better. I think many people don't know that if you are going to have a colonoscopy right now, 2 days before, you have to have a COVID test. And those are very easily done. You know, we don't have the shortages that we were having, you know, 5 months ago with this. And people don't realize, like, oh, everyone who's getting done that day for a colonoscopy got screened. And all of those employees who are in there taking care of me had their temperature taken. And they're all very close to what they have to do in terms of avoiding people. And I'm going to get screened for COVID before I'm even allowed into the building. And, you know, you now wait in your car, and even your loved one gets the instructions over the phone. And, you know, the offices have all of these, they've cut their number of people they're seeing in half, and, you know, finding out what your particular, you know, whatever test it is you're going for, whatever you want to help educate people about, getting those specific guidelines. They're all available out there. It's not difficult. And being able to tell your employee population why it is okay and why it's safe to do that, in terms of, or how to be as safe as possible. It is amazing to me, the lack of understanding and knowledge, you know, with some of our populations who aren't even at risk, who aren't doing what they need to be doing when they have a much greater risk by missing their medical care than by actually accessing that medical care. So helping kind of break down that education issue for your employee population, I think could be really, really helpful.
Yeah, I think safety is a big factor. And if we can continue to take away the barriers, the safety thing is probably number one on people's mind. And then, you know, there are a lot of other barriers in between: access, financial barriers, obviously, et cetera, that still we all have to work on together as a community. But safety is probably one that is prohibiting a lot of that care. I'm going to get to some of the questions that are coming in from the group. Let's see. Can Kathleen provide additional details on her screening campaigns at Nationwide, obviously? Example, more details on how they grew the colorectal screening campaign. How did you address PCP visits?
So in terms of the colorectal, so I think I told you years ago, we started with that happy birthday card. And then it became kind of a standard in our benefit presentations that, you know, hey, anybody turning 50 this year? I mean, to the point where I'd have people like stand up or raise their hand, and I'd be like, hey, happy birthday, you get a free birthday present from Nationwide, you get a colonoscopy. And don't do that without the cultural background to be able to do that. That doesn't always work. So just want to caution you there. But then continually putting it in front of people, right? Hey, you're 51, you're 52, did you have this done? It can't be a once a year. It needs to be more like, hey, what's your yearly checklist look like? And then once a quarter, did you hit it? What do you miss? And what do you need to get scheduled? I know a lot of people who talk about it around people's birthdays, and making sure that these annual things get done with particular birthdays. Some of the other things that we've done is Guts and Butts is actually at Nationwide was one of our March features, because it's also nutrition. There's a lot of national health observances for nutrition. We had a great gastro doc come on and talk about a lot of the myths out there and talk through procedures. You know, anything that you can do. I'm a big believer in following what people are already going to hear in the media. So following those national health observances really helps kind of drill what you've said at work with what they also hear on the news or read in a magazine. You know, they tend to follow those same kind of screenings. And then I think the biggest thing is, and then also pushing on the vendor to make sure that you have very tailored messaging so that when I see that message, I resonate, I see that story, and oh, that's me, I need to get that scheduled. But then evaluate. I think a lot of times stuff gets thrown out at people and, you know, hey, we're going to do this, we're going to do that. And then nobody goes back and says, did it work? Right? And so make sure if you're doing this, you know, if you're going to do a broadcast on a particular subject, you know, what was your tune-in rate? 3 weeks later, what was your on-demand rate? You know, make sure that you have a survey out there so people can tell you how that resonated and what else they'd like to see. Make sure that you're evaluating, hey, that worked or that didn't work. And I think that's where understanding your particular culture and your particular company and what would resonate with your company. And then even within your company, what would resonate for the type of work that you do. Years and years ago, I learned this lesson very, very early on. We were pushing a hypertension program that we were doing. And I went to the legal leaders and said, hey, we have this blood pressure program. I'd like to really talk to your associates about it and, you know, try to get it out there in front of them. And they said, okay, well, you need a really in-depth, long note, right? And I was like, what? And they were like, yeah, everything. How long is it going to take? How many phone calls? Who do they call? why should they do it? All the stats around hypertension and what's going to happen. And I was like, okay, we put our little team on it and created something. And I said, okay, so like, why are we doing this? And they said, well, these are lawyers who are used to, no lawyer jokes, I'm married to one, but they're used to getting really in-depth memos. They're used to getting lots of in-depth information. They're very detail oriented, or they would have hated law school. And so they want all of that. If it doesn't have that heft, then it won't seem important enough for their time to actually pay attention to it and do it. And I went to our bank leadership and said, hey, we have this hypertension, exact same program. And they said, okay, well, all of our folks are on the front line doing customer service. You can have 3 bullets. So give me, boom, boom, boom. Why should they do this? So, and the first 2 should be like, why should you do it? If you don't, you'll die. Not that far, but you know what I mean? And who do I call, right? Simple, 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 because that's how it works. So it's not even just the culture within your company. It can also be the type of work people do. How do you get to them? And what do they have time for? And what would resonate for them based on the type of work that they do?
Yeah. And I think, Kathleen, what's always been very impressive to me with the work that you did at Nationwide was, and I think this goes to the root of all of these types of communication campaigns, is you created a true culture of wellness at Nationwide, in which your employees were open to things like funny birthday cards for a colonoscopy. And it was part of their norm. It was what they were used to. But more importantly, you were really crafty at your target and knowing your audience, right? And so how to speak to different business groups about gaps in care and gaps in preventive care becomes the most important part of your campaign. If you're sending the 3 bullets to the lawyers, you failed, right? So I think that becomes why and how you continue to build on a culture of health. So I have a really good question that just came in.
Okay.
Talking about work, performance at work. And we talked earlier about how employers sometimes miss the effects on productivity of things as simple as preventive screenings. What are the implications of not getting screened on performance at work when people don't get screened and then they get ill, but they don't miss a lot of time through absence, but they're ill at work?
So I think that's one where you really need to pull in your HR business partners, right? Because that person is not performing. And so there's a conversation there about, with their leadership, about, now I'll split that. You could have a top performer who's now ignoring their health because they're giving everything to work, in which case you still need to have a conversation because they need to be getting better. And so there are times when you need to put your health and not being at work above being at work. And then you have people who are in that situation who are not performing, they're just absent at work. And then how do you have that conversation and make sure that that person, I think both of those go to the same issue though, and that's around permission to care for yourself. And I think, again, looking at your own culture, is there a way to craft that message? So at Nationwide, the mission was to provide extraordinary care to our, businesses and customers. And so you have to be able to give extraordinary care to yourself. If you're not taking care of yourself, how do you give that extraordinary care? So is there something in your mission? Is there something in the work that you do that you could craft that message that it is okay to take care of yourself, and there is a time and a place to do that?
Yeah, very good point. And it's sometimes difficult to create the culture that allows that in some businesses in particular, but it's something that groups should look at as a foundation of what they do to allow people to have the time and the space to get well.
And I think if you don't know what that is, I think ask your population, right? We used to survey our associates quite frequently. Ask them what it is that we need and what would resonate and what isn't resonating, and then go back and measure. I think people get involved in the communicating and the doing and forget to actually evaluate whether or not what they communicated and did had any impact.
That's right. And in your work at Nationwide, did you often measure the effects on productivity, things like productivity, absenteeism, presenteeism?
We did a lot of it early on. So when we first relaunched because we started the wellness programs, you know, those were started by nurses long before me, back in the 90s, right? And people would get a 27-page health assessment. But when we relaunched in 2006, really using the data to drive what the decisions were, and a really top, you know, the top of the house was on board with it, you know, much more sophisticated marketing. That was a huge piece. And we actually, you know, part of what my role was to create what was called a care report, which was the claims experience, the absence experience, and the risk profile, and then the education needed literally for every leader in the company. So you got your own report. That report has expanded and changed and added a lot of mental health features. And I would say that if someone wants to talk about those reports, contact me afterwards. I don't think we have enough time today, but really making sure leaders understood the importance of all of these pieces. And then the culture starts to take, you know, get that momentum, and there's so much less you have to do, right? I mean, you have to keep it going. You have to keep it on the path, but you're not pushing the rock uphill quite as much every day. The rock is definitely rolling downhill at that point.
Right, right. It's a building, right? It's a building of a culture and a concept for your employees that you build upon and build upon and build upon until they become familiar with it, and it's just part of what you do.
Yeah, and I say that back to the depression screening and the mental health, I think that one of the key reasons that the program has been as successful as it was at Nationwide has been around the fact that so I came out of the disability space and kind of came at this with looking at the disability and what was holding people up. And I believe very strongly that if you get the brain right, the body will follow. And I think a lot of companies are going at wellness with enticing you with the happy, joy programs, which are fun and you need to have, and those challenges, they're great. But if you're not going after the really large barriers like depression, like anxiety, like your mental health, like your domestic violence, like your financial stress, you're not really getting at the core barriers that are going to really change the culture and the trajectory of what's happening within the company.
Yeah, very true. We have another interesting question that I don't know if you know how to answer. I don't know that I do. Is it legal to have a behavioral health support group at work?
So I'm not a lawyer. So the one thing I do not answer legal questions. What I will tell you is my experience with some support groups. And generally speaking, support groups take off when you have a passionate group of people who need something. And once those needs are met and or the group starts to dissipate, they generally aren't as effective. I will tell you, I'm not a big believer in support groups within the workplace. And if one of you has a great support group, want to change my mind on that, please reach out. But we had them years ago. We had one for breast cancer one year, and people either did well or they did, and it was young women with breast cancer many years ago, and a couple of people died, and it really cycled down into because they had really bad outcomes, and then other people felt really guilty. And you know, matching folks up is different than a support group, and a support group needs a educated, experienced facilitator. And at least at Nationwide, with as many people as we had and as many offices that we had, it was not that was not a good way for us to deliver our messages. That may be different in other people's culture, and you may have one location where you can do that. It was not something that was that really kind of fit with ours, and it made me a little nervous because you get into HIPAA issues. And then I told this person, I heard this, and I saw them going into the support group on that. It just got very, there are a lot of inherent risks there. If you're doing it well, that's great. I'd love to hear how that's going. It is, in my experience, and those were all pre-2005 even, it wasn't something that lent itself to long-standing, sustainable programming,
right.
And we
makes sense.
have the people to try to do that across the whole company. And for us, it had to be scalable to everyone in the company, whether you work from home in Oklahoma or you're in the call center San Antonio or you're in corporate office in Columbus, and we couldn't deliver that same level of care. And so we didn't want to do things where the care was not consistent for each associate.
Yeah, no, that makes sense. One thing we have 6 minutes left, and I want to make sure that we give some real practical advice. So we've learned a lot today about preventive screenings, probably a subject that we thought we all knew and knew well, right? We've been doing this for many, many years, since the task force has been recommending them. I think most, if not all, employers have some sort of a strategy around preventive care and preventing screenings. COVID-19 has obviously thrown a wrench into whatever those plans were and whatever level of achievement you had gotten to. I think that what we need to do now, and if we all had a crystal ball, this would be fantastic, but I think the data is only just starting to come in, and we've all read frightening studies over the last 2 or 3 months that talk about the price, and when I say price, I do not mean just dollars, but the price of delayed and canceled and avoided care. What practical advice can you give employers right now, Kathleen, that they're looking back 18 months from now or 24 months from now when this avoided care becomes real and a real issue that we see in the data and in the health of our employees? What practical advice can you give employers to start really working on a campaign around getting back to good preventive care today? And if they don't, what would you predict, just in your opinion, that might happen in the next 18 to 24 months?
So I think we are going to see, personally, I think we're going to see an increase in, an ongoing increase in depression and suicide. We're already seeing that, right? Hundreds of, I think last time I saw it was like a jump of like 200 and some %. Suicides were already projected to increase every year through 2025. They've been increasing since 1999. While interestingly enough, across the world, suicide actually was falling. It was increasing in the United States. I think be very, very targeted, right? So I do think we're going to see results of people having much later diagnosed cancers. That's going to lead to much poorer outcomes and loss of life. And so I think what Erin has done with these 2 slides, if you don't know where to start with these 2 things, right? We're going to go after the depression or the mental health kind of aspect of our associates, and we're going to go after the colorectal and really focus on our over 50 population for that one particular thing. Again, look at your own data. Where are you low? What should you be doing? What should you be going after? I think if you tried to go after everything right now, especially if you aren't already doing this well, that's going to probably be a lot of activity that leads to very little outcome. So I would say be very, very targeted. I think Erin has produced some just amazing information that makes it very easy to communicate to your C-suite that, like, if we do nothing else, we've got to do these 2 things, right? And, and the other thing I want to really push is dental care. Dental care is one that if you could get people in for their dentist visits, oftentimes, because they're now checking blood pressure, and they can, dental care and eye exams don't feel as threatening to people, and yet they can actually diagnose and or see what's happening with the chronic disease. At Nationwide many years ago, we put in a program where your deductible was waived the next year if you went to the dentist in the previous year. And so that was a super easy way to drive great cleanings and screenings within the dental. Maybe it's not going after, every single thing on the screening checklist. Maybe you're going to target and say, we're going to really focus people into their dental exams and their colon cancer screenings and their mental health screenings. But pick a couple of these and get started. I would say that I hate the term new normal. I've been protesting it since April. This is just our norm. This is our norm. This is, it's not necessarily about what's coming at you. It's about teaching your body to respond appropriately to what's coming at you. We can't control everything that's coming at us. So let's help our associates control what they can. And the things that you can control are not missing those physicals and not missing that preventive care and not missing your dentist appointment. You know, let's put some structure in place there, because that's the norm. And we want you to really focus on the norm.
Makes total sense. Well, Kathleen, as always, thank you for your expertise and your opinions in this. They mean so much to us. You've been very successful in the past in really cracking this hard thing to crack in an employee population as diverse as Nationwide's was. I'd like to thank Erin for her very hard work in all this research. You've brought together a great group of things for us to all work on and look at together. I'll remind everybody on the phone that IBI is having our Health and Productivity Forum, which is of course virtual, beginning on September 14th, if you'd like to see more information on our website. So thanks for joining us all today and taking the time. We appreciate you. Have a great day.